Before I get started, I want to make a few disclaimers and explain kind of what I'm going to be talking about today. So firstly, for those of you that didn't raise your hands, don't be afraid at all. I didn't start doing any research pretty much until halfway into my internship. So just to highlight, there's no single right way to go about all of this. I think all three of us have had different journeys so far. Myself, I've been working full-time since I graduated. I didn't do any research pretty much throughout medical school and only started halfway through my internship. So don't be afraid if you didn't put your hand up to start with. Number one disclaimer, so this is a research-specific talk, okay? But research is one component, a very important component about being an excellent clinician, okay? So we're focusing very much on this throughout the evening, and it's the area of interest, but don't just take that away as the sole focus of your ongoing career, okay? The fact that a lot of you are here, it's been echoed by the other two as well, is awesome, okay? As I said, I wasn't even doing any research throughout medical school, so coming to these sort of events is a big deal, okay? Number two, which I've already touched on, there is no right way, okay? There are some wrong ways, which I'll try and touch on today, but there is no right single way, okay? And then lastly, without getting too cliche, you are very much in control of your journey, okay? So a lot of you here may not be striving for really competitive specialties. Some of you here that may be the only thing you care about right now, okay? But you are in control and you can fine-tune it according to what you want to do. So, for those that maybe know me a little well, they know I'm slightly obsessed with Batman. So I thought it'd be remiss without including him in the presentation. So, I've sort of presented this at previous talks, but essentially, a very crude way to look at your career or your pathway to try and simplify it is essentially breaking it up into different phases.
Recording your sound.
Oh, that's all right. Now, this varies according to what specialty pathway you want to go down. For me, I want to do cardiology. So I think an important part of it, identifying, is firstly, what does my training look like? How much research do I need to be doing? Will it impede my clinical performance? Or will it enhance my clinical performance? And where can I actually fit this in? So this is the conventional pathway that has probably colloquially been taught to you guys, or you've heard it from your peers, especially for physician training. The first phase, you sort of relax a little bit, you get your time in hospital, and then the second phase, once you've passed your exams or once you're training for your exams, is when you start really putting on the gas. I've talked about this before, and I think it's been echoed before as well. I'm a big advocate for starting early, okay? I didn't start research until halfway into my internship, but I believe that you should start as early as possible, not just for the purposes of getting onto a program, but it just elevates your overall career, academic, and clinical profile to a higher level. Now, I'm going to share with you over the next hopefully 10 to 15 minutes my own journey, but some of the specific projects I was a part of, the specific examples involved with that, and hopefully it gives you a bit of a tangible lesson in terms of what to avoid and maybe something you can try and implement in your own work going forward. So, the first lesson, or the first phase that I call it, is the cold approach, okay? So, if you're ever anywhere you need to try and talk to someone, how do you start, okay? Now, this is probably what you guys are looking like right now, deep inside. So this is Kevin from Home Alone 2, if you're not aware. This is when he first sees New York and he has an absolute shock. He's overwhelmed, he's got no idea what's going on. That's how I was pretty much towards the end of my medical school journey, and probably even the first part of my internship when I was thinking about research. It felt like some sort of hidden secret that you see these people that got all these hundreds of publications, and then you're just sitting there barely even knowing, what an RCT is, or you're barely just trying to get through your EBM questions or your exam, okay? So I'm gonna try and unpackage it for you. This is not an all-encompassing talk, but it's just to highlight some of the key lessons and hopefully give you some motivation going forward. So, a question that I've been getting quite a lot over the last year or 2 years is, how do I start research? How do I get involved with a supervisor, okay? So this is the conventional method that I was sort of taught by my mentors, what I was coming across, and some of the things you hear quite colloquially. I've called it connections. It's a little bit of a joke I've got with my friends, okay? Connections, you feel cool sometimes at the end of medical school. I know this guy and he's a consultant, or I know this guy, he's an AT, or I know this guy is a set trainee, or I know this amazing consultant. that's sort of the vibe I used to get with it, and that's why I called it connections, okay? So you classically get told, build your connections, okay? Approach supervisors, build connections. And then once you do that, you just approach someone, you tell them, I'm really interested in this field, can you help me out with some research, okay? And then you hopefully get given, some research, anything, you make good of yourself, you perform well, and then that just becomes a feedback cycle where you start working with more people and you do more things, you make more connections, and it just keeps going, okay? Now, that didn't work out for me whatsoever, okay? Not to say that it's the wrong method, it's definitely not the wrong method. There's a lot of elements in that hold true even today. But I'm just trying to highlight to you that it doesn't often go that linear path. And what I'm highlighting here now is some of the issues that I had with my approach and how I think you should go about it and how I would go about it in retrospect, okay? So number one question is, it's great to think about research, but are you actually ready to do it? And I'm not talking about, do I know how to do research if I've ever done research before? Are you in a stage in your life where you can sit down for a whole weekend or sometimes a whole night? Not saying that you have to do that, but are you mentally prepared to do that? No, yes, maybe, sure, okay. Now the next question is, are you doing a very difficult placement, or do you even care enough about the pathway that you're going? Those are some of the questions that there's no right or wrong answer to. You just need to be honest with yourself, okay? Honesty is the best way to start. And for me, I get a lot of medical students who come approach me, very, very talented medical students, very, very hungry and motivated. But the first question I always ask them is, when's your next exam? Because you have to balance this with other stuff. If you're trying to do it all at the same time, you need to balance and prioritize things, okay? So one of my close colleagues who I'll talk to you about, he actually came up to me in his 4th year, I think, right? And he said, hey, Ammar, I want to get involved with research. What do you think? And I said, look, man, I think 6 months, don't do anything. You've got exams coming up. I wouldn't recommend it, right? And he came back 6 months later, but he always says to me that was one of the best things I did because I just wasn't ready. And your introduction to these things is very, very vital. So don't come in prematurely, all right? The next thing, so rather than building connections, don't view departments as like a political playground. It's a real life place. Every rotation is integral. So as I gave you my story, when I started cardiology, I was expecting, this would be showtime, we're going to get so much research going, it's going to be awesome. I was very, very excited. But my best term, or potentially the career-changing term for me, was my vascular surgery term, because I actually approached it, I was like, of all the surgical terms I've heard, this team is really, really good. They carry themselves in a certain way. They're very, very patient-orientated. They take their careers very seriously, not saying that others don't, but they really get the juniors involved, okay? And that example where that consultant just called up a cardiologist, not many people do that, okay? So that term really, really showed me what integral work ethic is all about, how you set up your CV, what type of research you should be doing, and more importantly, it actually was the building block for getting me in touch with some of my other mentors. And then the biggest message I want you to take away from this slide, okay, before the last box, is the first paper is your holy grail. What I mean by that is that first paper, as Josh alluded to earlier, can maybe take you years. It can maybe take you months if you're very, very lucky and good. It can sometimes take you a year. But that paper, you should obsess over that paper, because that's your first chance at doing something great, but it's also the first chance you're learning something. And that will set the tone for all your other projects going forward. So rather than looking at the number at times of publications people have, or how many publications you have or you don't have, when you get that project, it doesn't matter where it is, it doesn't matter what specialty, that is your thing that you can actually use to build your skills. And however long it takes, you have to make sure that you do it to a high quality, okay? And I'm going to touch on this in the next few slides. And then, to tie it all together, I actually personally think you should only approach senior consultants. And you think about it, it's not because you have to be great, it's just because these people are busy. They're very, very busy. Half of them even tell me, I don't even look at my emails, okay? So you should approach them either if you build rapport, and I don't mean he's a good guy, I played golf with him. I mean, I've worked with this consultant, or they've worked with me for 12 weeks. I've gotten to know them. I feel like I'm comfortable around them. I'm comfortable enough to ask them because I feel like they're going to give me some genuine advice. That's A. B is the necessary skills. And that comes back to the box above. You have to, if you demonstrate to someone that I can actually carry this out, I have the skills necessary, automatically they're more likely to give you ideas, or they're more likely to give you research initiatives. One of the key things that if you're very busy, you can imagine if someone more junior to you comes to you and asks you for research, you're kind of like, man, firstly, do I even have an idea? Secondly, do I have time to teach this person? These are a lot of the questions. So if you can come with skills, any skills, and that's where I go back to the fact that it doesn't matter what paper you've done before. If you're looking to do neurosurgery, for instance, even if you've done a paper in psychiatry, if you've done a paper in obs and gyn, if you've shown them you've got skills, you're already ahead of the game. And then finally, and this is something that I'll show you guys in the next few slides, if you come with the final product, you're ahead of the game. You come with someone, you come to a consultant, you say, I've already done a paper, can I get your advice? You come in a humble manner, you're much more likely to get responses because you've already done a lot of the work. So, I'm going to quickly try and share with you a real example of my first project, okay? And it's to highlight some of the points I've already talked about. So, 6 months into internship, okay, I've managed to get my head above water. I think I kind of know what doing internship is kind of about. And I realized, oh no, some of my competition, I call them competition in quotation marks because they're not really competition, but some of the people that are also trying to do cardiology around Australia, they've got like 30, 40 publications. And I'm here scratching my head about what even is EBM and what even is an RCT. What do I do, okay? So, I was very fortunate that some of my closest mentors, and I actually forgot to mention something that Elizabeth talked about earlier on. Your closest mentors are sometimes early career researchers because they're more relatable to you. They've been in that process a lot more recently. Sometimes consultants, as skillful and as talented as they are and experienced as they are, they probably did this 15 years ago, 10, 15 years ago, and they may not have the time to give you that intimate advice, okay? So one of my closest mentors and friends, he said, I've got a half-baked idea, but can you just get it done somehow? You've got endless time, just figure out a way to get this done, okay? So I scrambled, I went back and forth, I made a lot of mistakes, but I realized at the end of that journey, and I'll share some of the actual logic of that with you in the coming slide. I realized at the end of that journey, as slow as it was, you establish a blueprint, okay? And keep that in mind as we go forward. So, without getting into the technicalities, you first have to identify what type of study you want to do, okay? This is stuff that we can teach you going forward. This is stuff that you will be learning as you dig your hands into this. But one of the key things for me was I realized systematic reviews are a little bit more affordable to me because I don't have to go through this ethics process, okay? But for those of you that are not familiar with that, just realize you kind of need to know what study you want to do. And oftentimes this is the first thing to get familiar with. And then over the next sort of 12 to 18 months, I scrambled. And all of these phases, now that I've got this very clean blueprint that I use, all of these phases took me enormous amounts of time, enormous amounts of barriers, a lot of collaboration, a lot of talking to other people, but a lot of hard work as well. And two examples that I've highlighted there. One was a search strategy, how to build this. I once spent an entire weekend looking at these YouTube videos that I've highlighted here, how to build this. I went to a librarian, and oftentimes it just takes weeks. It can take time to learn this skill. The second thing, the 7 number, is I had no idea how to do a meta-analysis. I've heard of this thing. I'd finally gotten through 1 to 6. I'd put a lot of work in. I thought I was doing a decent job. And then I got to number 7, and then I'd actually teed up a statistician. I thought I was, pretty game for that. I got in touch with a statistician. I said, hey, can you help me? That statistician actually went overseas. So I was like, man, this is happening again, I need to find someone that can help me. And then I came across an excellent statistician from Bonn. But he said to me, look, I like what you're doing, but I just don't have the time to do your stats. I can only maybe teach you. Do you want to come to my office sometime and I can teach you? So he actually, over the next few weeks, I spent every Friday afternoon with him, and I learnt how to do meta-analysis. I learnt how to do various other statistical methods. And then the same thing happened with number 8. My mentor, who had told me the whole way through, yeah man, I'll handle the manuscript, you just get it to number 6, okay? He was like, I'm pretty busy right now, can you just give 8 a crack? And then again, it was in that same position, looking at previous papers, looking at what he had done, looking at other people done, and trying to synthesize something, a basic draft. And then I got hammered during the draft. There was a lot of drafts. And then we took it to our consultants. But at the end of all that, I learned how to establish a blueprint. And then it's not rosy from there. What happened after that? You have to try and submit this stuff. So I'm submitting it to all these cool journals. I feel so good about myself. And then rejection. This is months. But then that right photo over there, that's 1 page out of 6 of the comments that were provided to me, okay, for my first paper. And those 6 pages taught me more about research than I probably learned in the last 3 years combined. And I'm bringing it back to this graph again. I was scrambling. I've only got 0 publications. Hurry up, guys. Where's the statistician gone? What's going on here? I'm on 0 right now. Come on, you know? But now I look back and I go, embrace the rejection. Embrace all those barriers, because they're only making you better and better. And what I realized by the end of this, so this is all really cool, you know, my first publication, we got it in BMJ Open Heart. It was a great experience. But I was always looking at that number, because I'm very obsessed with competition at times. And I kept thinking, oh, you know, I need to do this again and again. And I had that blueprint. But the most important thing out of all of this was when I went full circle, I realized I can do a meta-analysis. I've got a statistician. I've got a network of consultants and registrars who now believe in me. I know how to write a manuscript, right? This may have taken me 18 months, which is quite quick. There was a lot of rejections. I've got a whole panel of comments now that I've learned so much about. I can now apply this to any other idea that I have, this template, right? So that brings me to the final phase, okay? Now, I call it fasten your seatbelts, because for me that was a light bulb moment, right? I realized I've got this template. I realized I've got some secret skills. It's time to make this count, right? I've got 6 months. I've got now 6 months of about easy terms. I'm about end of my internship. I'm going into my 2nd year, which is a JHO year, they call it. I've got some time now to really put some gas on the pedal, right? And one of the things I did that year, and this is alluding to one of the other questions I sometimes get, which is, how do I think of ideas? Sometimes it can be quite crude, right? So I went to a conference in my intern year, just as an observer, as a silent observer, like no papers, nothing, literally just rocked up, okay? And I went to the back section where I saw all the papers. And one thing I saw, and one thing you've probably already seen from the other talks, is COVID was a very interesting topic at one point, okay? So I decided, look, and maybe a place to start for my next project is COVID, right? It seems pretty topical. You know, I'll do a little bit of reading into it. So what I did was, I actually had a light bulb moment at the start of my intern year. I was like, you know, people are facing a lot of various challenges with COVID, particularly in the subset of population of aortic stenosis patients, not trying to bore you guys. And I messaged this to one of my closest friend groups, because I was trying to collaborate at the time, right? I was like, this is awesome. We've got an idea. I've got the skills necessary. Lads, I've got a research idea. Let's go. They kind of laughed at me like, this guy is a bit crazy, you know? He's got this idea. It's not going to work. It seems a bit, you know, childish, whatever. Let's see what happens. So over the course of the next few months, I aggressively pursued this idea. And it actually only took me about 4 weeks to do, because I had that blueprint. It comes back to that blue thing. What took me 18 months before took me 1 month now. And I was extremely fortunate. This paper got accepted to present at the biggest cardiology conference in the world last year in Amsterdam. So these things are real. This can happen in front of your own eyes. It can be something you're doing in your room. It can be something that you think is going nowhere, and it can suddenly just become something legit, right? So there's not that much difference between something that seems like an idea and something that is quite legit. The same story for this paper down here. So this paper, one of my good friends, Ashray, I think Josh had told you about, he had noticed that I was a little bit aggressive and good at meta-analysis. So he said, I've got a paper for you. We've got about a week or 2 weeks until a deadline. Do you reckon you can maybe get something going? And at the time he had told me, just get something going. He didn't expect me to try and do the whole paper. Me, high off the success of this, high off the previous thing, having that blueprint. I was on a flight to the USA at the time. I was extremely bored. I can't watch movies on flights. There's too much noise. I I did a meta-analysis on the flight. I was like, I've got this thing going, I've got the momentum, let's get this done. And that paper also landed that same conference, right? Now, the same blueprint. I went to that conference, ESC, went to the back, where not many people were hidden, looked at the ideas at the time. What are some of the topical things? What are things people are talking about right now? I'm not a very smart guy. I'm not an expert clinician. I have to think of patterns and find ways and find things that are quite topical before I dive into research, right? And one of the things I found at the time, and again, maybe alluded to earlier in the talk, is AI is everywhere. Artificial intelligence, machine learning. Everybody's talking about this. What is this? This seems like a pretty nifty way or pretty cool way to do research. It's actually affecting people's outcomes. There's high quality and low quality research being published on it. How do I approach this? Where do I start? And over the next few months, I had a rotation called After Hours. It's one of the great rotations, let's put it that way, of GCUH, where you just do night shifts for a whole 12 weeks. And I really tried to define this idea even further. And one of the things Elizabeth mentioned before is focus on quality. And now that I've learned my lesson that it doesn't matter about how many publications you have to do something properly, I realize we have potentially something pretty cool here. There's a lot of ideas. Sometimes you find ideas that can just lead to more ideas. And this is a message I sent Ashray, one of my really good friends. I sent this message to him at 6 o'clock in the morning at the end of a night shift, because I was just scrolling through machine learning and I found about 12 different ideas that we could do a paper on, right? And he's just waking up and he's like, man, this guy is just bothering me, right? But that actually formulated into something really, really cool we did at the end of last year. So we realized we have a lot of these ideas, but as Josh alluded to earlier, one person or two people can only do so much. You need to try and make a team of people that are not only like-minded, people that are not only motivated, but people that are genuine, right? And we actually ran a Zoom session over actually one day, of about 40 of you guys, medical students, guys who are motivated, people who are looking to get some research skills, and we identified what everybody's level is, what everybody's trying to get out of this, and we put together about 5 to 6 projects that we conducted on that one day, 5 to 6 systematic reviews, with all the blueprints which I had learned already outlined for each project. And once again, this stuff landed great things. It landed the most recent cardiology conference, the same one I went to in London recently. It's one of the papers is about to get, all of these papers have been presented. One of the papers is landed the best cardiology journal in the world, European Heart Journal. And most importantly, you get to work with people all around Australia, even internationally. You're exposed to even more networks of people, okay? So that is a real life example of how a blueprint that was established in someone's bedroom, and after a lot of, you can call it hard work, but people work a lot harder at times as well for limited success. And then it led to a real outcome. I want to touch on this story because this is as real as it gets. This guy is sitting in the crowd right now. His name's Dawood. I think he's a final year student. So Dawood is a very good friend of mine, and he came to me in his sort of final year and he said similar things. I want to try and learn research, and I sort of, told him about the blueprint. I was still trying to figure things out at the time. And this story is pretty cool because this all is run pretty much by Dawood. He learned some things from the blueprint, but he had his own visions, his own ideas. And together, we tried to embark on a project that a statistician had told us is pretty much he can't do. It's a bit difficult. It doesn't seem quite right. There's a lot of data that's required. So we had that same vigor that I had in the final year, where there's 2 weeks left until the deadline. We got together. I came back from an evening shift, and he said, "I'm ready to go. Let's do this." So this is us in a Zoom call. And within that weekend, we put together this thing called a network meta-analysis, right? It looks pretty complicated, but it's actually just like the other things. When you get down to the basics, it's not that complicated, okay? You can work your way through it. And this, like the other stuff, I had the privilege of presenting in London. He presented in Perth. But not to highlight to you guys of how cool some of this stuff is, and we can do all these projects. The main message here is that all of this is achievable. You are in control of it, and focus on establishing your blueprint and focus on quality rather than getting carried away with numbers and getting carried away with connections. So that summarizes the key lessons. I hope you guys learned something from it, and I'm sure I've learned something from the other two speakers as well. And thank you all for having me.